for you, how has the state of care sort of changed, and what role has awareness and efforts like this sort of played in that, in sort of getting the ball rolling and getting more options for patients?
Well, the first thing to remember is I've been a neurologist for a long time. And when I came into neurology, there were no disease-modifying therapies whatsoever. So that if you had MS, we could educate, we could diagnose, but we couldn't change the trajectory of MS until 1993. So in 1993, we had one medication. In the early 90s, we increased that to a few medications. And they were for relapsing forms of MS. And the really gratifying part of being able to maintain an MS practice is how it's evolved and how much more is offered to clinicians treating MS, but more importantly, to people with MS. And so we've been able to change. Sometimes people say, what is it about MS that interests you? And my fairly routine answer, besides the explosion of knowledge, is the ability to change the trajectory of a life. And so if you said, are we getting better and better at treating relapsing forms of MS? Have we gone from 0 meds to a few meds to more than 20 meds? Absolutely. If you said with regards to progressive, we think we're best at treating the inflammatory part of MS. We think that we have not been as successful in treating progression in MS, but that's one of the reasons that a lot of attention has been placed on treating progressive forms of MS, and particularly what we call active progressive MS. And I think, as you know, Mayzent has been a large part of that. It's not that there is a single medication, but rather that the trials that involved Mayzent were trials that I think were important for getting rid of the nihilism about progressive MS. And so up to that point in time, there had been a great deal of nihilism based on some of the French literature stating that once you reached a certain level of disability, there wasn't much you could do. I think that the Mayzent trial was most important for me as a clinician in showing that in a population with more severe MS, older population, longer duration, that there was still a lot we could do to change the trajectory. So for me, it was a way of challenging successfully the nihilism that is, sure, you could do something early on, but not when there's progression. I think the belief now, based on a lot of data, is that when there's active secondary progressive MS, there's more we should do and can.